All right, well, healthcare was on the agenda this morning at a coffee shop in Montreal. Prime Minister Justin Trudeau met Quebec Premier François Legault there after last week's sit-down was postponed by weather. Now, once finished, Legault spoke to reporters and hinted that maybe he's ready to accept one of the federal government's funding conditions.
I think that there's a way there. There's a compromise that looks good for everybody. We already publish on a regular basis all kind of data, and so we have no problem sharing that with the federal government.
For months now, doctors and nurses across the country have pleaded for help, saying the healthcare system is buckling. Dr. Alika Lafontaine is a practicing physician in Grand Prairie, Alberta, and the president of the Canadian Medical Association, and he joins me now. Dr. Lafontaine, you're good with complex diagnosis. How can we have the Prime Minister saying the strings are still on the table, but the Quebec Premier saying he's suddenly more optimistic? How do you reconcile these comments today?
You know, I think one of the most important things to remember is that patients across the country and providers across the country just want a solution to this problem. And the narrative around the CHT having to be signed before doing any of these things that could fix the healthcare system is probably not a complete narrative. You know, we see advances in Quebec when it comes to data. We know team-based care works very well in places like Alberta with primary care networks. You know, there are these pockets where we are doing the right things. Tying funding to those things that have impact, it makes a lot of sense. And I'm pretty excited that there is some talk from premiers about moving forward in this direction, but we'll have to see the action that comes along with it.
How important is it to get a deal, though, on the Canada Health Transfer? I know you say there are things provinces could do in their jurisdictions without a new funding agreement with the federal government, but they seem kind of focused on that, right, as their primary objective. They want this meeting in the new year and they want to get this deal done. So how important is it, do you think, to get the momentum for these reforms?
You know, I think we see what's important as what's in front of us. You know, what is in front of premiers right now is the funding issue. What's in front of Canadians? It's the deteriorating healthcare system. You know, millions of Canadians can't find a family physician. Millions of health services have been delayed because of the pandemic and other issues. You know, we're having deteriorating conditions that are affecting frontline providers. Patients are waiting almost an entire day to be seen for care. You know, we really can't adopt this narrative that we have to wait for these changes to happen. And some of them are moving forward already. So do we need an injection of funding? Absolutely, but it has to go to the right places.
I think the last time you and I spoke was right before the health ministers got together in Vancouver. And that didn't go too well, right? I mean, there was a news release calling the meetings a failure before they were even over. And it seems like things have been kind of stuck in neutral since then. I mean, what's your sense of just how this has played out at the political level while you and other frontline health professionals are dealing with this crisis in the system?
You know, the most frustrating part of the discussion is we actually know what needs to change. You know, we have had multiple studies over the last 20 years that have all identified what needs to move forward, improving mobility of people across jurisdictions through pan-Canadian licensure, team-based care as a way to maximize the time that patients can see people for the right things in the right ways. You know, decreasing the administrative burden on the shoulders of clinicians away to other parts of the system so they have more time to see patients. You know, these types of things we know we need to move towards. Having things progress in the way that they have, where people are saying, you know, we have to stop before the funding gets arranged before moving forward with these things that we know can work and have worked. You know, it is frustrating, but I'm looking forward to what comes in the new year. Best gift that governments can give Canadians and providers and patients is to actually get things moving forward and getting these problems solved.
But are there big things, you went through a list of things there. I mean, some of these things are within the provincial power to start dealing with right now. I mean, what are the big things that they're not doing while instead there's this bit of a showdown happening with the Prime Minister over funding?
You know, I think the biggest problem that's not happening is that people aren't moving into the solutions that we know can solve issues. So like you said, a lot of these fall within provincial jurisdiction. You know, it is important in the federal provincial discussion to recognize that the federal government's there as a funder and a collaborator. Mm-hmm. Provinces are there to fix healthcare systems, and provinces have always had the power to move forward with a lot of these issues. You know, it is not, the narrative is not that we have to wait for funding to be in place before we can start moving forward with solutions.
What do you make of the fact that the Prime Minister seemingly adopted the use of the phrase "a broken system"? You know, something that you wrote and have said in the past. It's now been adopted pretty strongly and repeatedly by the Prime Minister, sort of to buttress his argument in this showdown with the premiers. You're worried about your being kind of dragged into the middle of this, maybe in a way that you weren't intending when you issued that call for reform?
I think that statement is something that's heard from providers and patients across the country. When a parent shows up with their child to a place overwhelmed with a pediatric respiratory crisis, and they find that they can't get the care that they need, or their child has to be transported after admission to another hospital in a different part of the country, it's fair and transparent to actually say that the system is broken. But I will say that one thing that I haven't said, and that providers across the country aren't saying, and that the Prime Minister did not say, is that this can't be fixed. And I think that's the place that the conversation has to go. We have solutions. We have things that can fix the system. We have to get to fixing things.
So fixing it, though, does come with a cost, right? And so it's obvious there is going to be need to be some sort of extra transfer of cash from the federal government to the provinces to do this. Like, just to use the example of reducing the administrative burden on clinicians that you spoke about, that could require hiring administrative people to handle a lot of that stuff. That is not a task that will go away. So do you have a sense on the quantum, to use a word some of the premiers use, on how much money the federal government needs to hand over to the provinces in a renegotiated Canada Health transfer to start making the serious reform that you and your colleagues want to see?
So I think that is one part of the discussion that I will stay out of. What do we know for sure? We know that there needs to be additional funding. It has to be targeted in the right places. And it has to be based off of things that providers are telling governments that we need. The most important part of the medical encounter is not the administrative part. It's not the funding part. It's the face time that we actually have with patients so we can make a difference in their lives. And so, do we know that funding has to increase? Absolutely. I think the Prime Minister's been clear on that. Providers have been clear on that. Premiers are on side with that as well. How much that is needed, I think that's a discussion I'll leave up to the politicians.
So just a final point, Doctor. We talk about the system being in crisis, under enormous strain, especially with the waves of respiratory viruses that have hit the system throughout the last weeks and months. How much longer do you think the system can endure what's going on before it really gets to a point of, I don't know, pandemic level sort of crisis? I mean, is that something that's in the foreseeable future, or is that something that we can avoid?
So I think it's happening right now. It depends who you talk to. If you talk to the parent who can't get care for their child, the system has collapsed for that person. If you talk to the family who can't find a family physician, the system's collapsed for that person. If you talk to the nurse or the physician who's now on their second or third overtime or a repeat day of call because there's no one to cover for patients, the system has collapsed. And so we are witnessing a collapse in different parts of the system. One of the frustrating parts of the narrative and making sure people understand, particularly politicians, is that stress always travels downhill and it ends up falling on the shoulders of our frontline and patients. So, I recommend to patients across the country, make sure to implement those things that worked in previous waves of respiratory illness. Get vaccinated, socially distance if you feel sick, consider masking as well as other public health interventions. And I really advise governments, this will continue to get worse. It will continue to deteriorate. We're on the edge of hopelessness, I think, for a lot of us working on the front line. Once we get into indifference, things will get worse. And so we need action now. It is always the most cost effective to work with the crisis as soon as it occurs. So the longer we wait, the more expensive this is going to be.
Okay. Dr. Alika Lafontaine, thank you so much for your time.
Thanks for having me.